So when we're discussing the opioid problem, we in West Virginia have been particularly hard hit. Unfortunately, if you do any type of search on the internet, the state of West Virginia is going to pop up in many ways. For example, if you get some statistics, you will notice that we have the highest per capita overdose rate in the country. We have about 41.5 deaths per 100,000. The national mean's about 16, so we have a significantly higher percentage of that. Currently, they're saying that over 20% of the babies in the state have been exposed to heroin.
Do you remember the first time you admitted to yourself that the opioid epidemic was a true crisis and that our country's clinical public health care system was losing the battle? It may have been when you saw a story about the crisis, profiled on the evening news. Or maybe when you read about a family in your local newspaper that chronicled the cycle of overdose, detox, and recovery. For me, the moment of realization came last summer when I read about a small town in West Virginia where I had spent 6 months as a PA student in the late 1970s. I could barely recognize the town now. The pain and loss I felt prompted me to want to learn more about the problem. The opioid epidemic that we are living through in this country is much bigger than many people realize. About 115 people each day are dying from opioid overdoses in the United States. That's more than 40,000 people a year. And one of these individuals could have been a patient seen by you or one of your students. The economic costs are also staggering. We are talking about more than $500 billion a year, according to one report. This is a true public health crisis, and it's crucial that all of us in healthcare and healthcare education do our part to address it.
I think this is a rubber meets the road problem. We are primary care providers. We are frontline providers. So we, as PAs, are seeing these patients many times first. And so if you look at the data, you're seeing that most of these people that have overdosed have seen some kind of healthcare provider first, sometimes more than one healthcare providers before they overdose. So if you're working in rural areas, as many times in West Virginia, if you're working the ER, the primary care, even urgent cares, so it's just something that we're going to see. And so we decided to make several changes all across our curriculum. So for example, we added approximately 11 hours in our didactic curriculum through several different courses. We had an emergency medicine physician come in and specifically talk about the recognition, diagnosis, treatment of overdoses of opiates as well as other substances.
At PAEA, we are proud to be partnering with the American Academy of Addiction Psychiatry in the State Targeted Response Grant. This grant from the Substance Abuse and Mental Health Services Administration aims to increase the training of PA students and PA educators to treat opioid use disorder. Students and educators who complete this training will be eligible for the DEA waiver they need to prescribe buprenorphine as medication-assisted treatment, or MAT for short. For the PA education community, the good news is there is an excellent curriculum already in place, the Provider's Clinical Support System curriculum. The curriculum consists of 24 hours of online content, and it can be completed at the student's own pace in either the didactic or the clinical year, along with other behavioral health classes or clinical rotations. There are also webinars, clinical resources, and even online coaching available. The curriculum covers issues like pharmacotherapeutics, pain, responsible prescribing, and addiction. And of course, the use of MAT to treat opioid use disorder.
In thinking about why a PA program would decide to incorporate the MAT training into their curriculum, I think the better question is, why not? It's a proven and effective strategy to help combat opioid use disorder. And here in New Hampshire, where we have the second highest death rate in the country from overdose, each and every tool that can be used to combat that sad phenomenon should be explored.
PAEA is committed to doing everything we can to help address the opioid epidemic. We will be working with our member programs to get as many students and educators trained as possible. The grant provides us the resources to hire a full-time project director who will focus solely on working with programs to help us hit the target of 30% of PA students and 30% of faculty becoming waiver eligible. Completing this training will make our students even more marketable. To graduate already waiver eligible will give them a valuable leg up when they start applying for jobs. Also, don't forget that waiver training earns each faculty member 24 hours of Category 1 CME. And oh, did I mention that the training is free?
Studies have shown that MAT can have a greater than 50% cure rate for addiction. But if providers don't know about it, then they're not going to prescribe it. We need to spread the word.
To learn more about MAT waivers and eligibility, check out all the helpful resources on the Providers Clinical Support System website.